And why this strategy, and what's the importance of the timing now?
Thanks very much, Jenny. I think in answer to your question about why this work is important in the larger community is actually fundamental to this strategy. Increasingly, Washington State is recognized nationally as well as within the state itself of really leveraging health information technology and all that potential that holds for improving health, not only at the community level, but also at the individual level. So increasingly, we are hearing requests from communities as well as healthcare systems and providers to ask us to help them support the work that they need to do to achieve the three-part aim of better health, lower costs, and improved care experience for all the folks that they serve in their clinical practices, but also in the communities themselves. So as we move the healthcare system from facilities and doctors' offices out to the community and join our community partners, whether it's housing services or whether it's mental health services or it's our public health partners, we want to be able to share some of the information that we can to improve the health of populations as well as the individuals that reside within our communities. So it's an idea to me that as time has come, we've spent billions of dollars in this state, if you count it all up, on developing electronic health records. And now people are beginning to see that the potential from that investment now is able to be leveraged to really look across the state at the community level as well as at the individual level on how people are doing in terms of health improvement strategies and new and innovative ways to improve health. Why this strategy and why now? I think, as I said, it's an idea that's time has come with the current investments. It's time now to really push the state to the next level of not only innovation and care delivery, but also in terms of leveraging the investments that have been made. Improved interoperability across providers and access to the clinical data that we now have in various parts of the state in our delivery systems will greatly enhance our ability to achieve better health and better care, and ultimately at the lower costs that we also want to achieve. We'll be able to now support with this new infrastructure what our state innovation plan calls for and what our governor is calling for in terms of pushing from purchasing for volume to purchasing for value in all of the work that we do. Healthcare Authority itself purchases care for well over 1.5 million people, and to the extent that we have data that shows what's working and what isn't from a value-based perspective, we can move away from purchasing at a fee-for-service level and really incorporate this clinical data into our decisions about how we want to support our clinical providers in providing care in a different way. Equally important, I think, is the self-management tools that can come along with this investment, so you as a person, as a patient, can understand your own clinical data and join forces with physicians and others in your community to help improve your own health, as well as partner with your providers to improve your healthcare decisions that you make. And then lastly, I think, although this is a little bit more complicated perhaps, and I will emphasize before I say this, that privacy, security around all this data is ultimately the job number one, so that we protect people's individual privacy. But with a clinical data repository, we have the ability now to really look at population health status of every community in the state at micro levels as well as broad picture levels to say, geez, if we really are intent on helping people stop smoking, for example, or stay active, eat more healthily so that they maintain a healthy weight, for example. We can all do that now with this data repository at that population level that we can see if our strategies are working. So in short, it's an idea this time has come, and our providers, our public health system, and our community partners are ready to join with us to work with this data.